speak about neurotrophic keratitis and its relation to infection with COVID-19. The most presentations of COVID-19 is relapsing keratoconjunctivitis, but there is recorded cases, 3 cases of neurotrophic keratitis occur secondary to medullary infarction due to COVID-19 infection. Neurotrophic keratitis, before we begin, we'll just remind you by the innervation of the corneal tip from the 5th nerve trigeminal that give ophthalmic and nasociliary and 2 lung ciliary nerves, then make a plexus around the limbus, then piercing and enter the limbus as medullated nerve fibers, then loss of its myelin sheath in a radial matter like that to form 3 types of plexus, subepithelial and interepithelial. Actually, there is 3 types of plexus: sublumen membrane plexus, subbasal plexus, and interepithelial plexus that's seen by in vivo confocal microscopy. Lesion of the 5th nerve lead to an interruption of the normal corneal sensation, lead to edema, exfoliation, ulceration, and secondary infection of the cornea. Corneal diminished sensation will lead to diminished lacrimation, that lead to epithelial breakdown and exfoliation, that lead to persistent epithelial defects that may lead to secondary infection, and melting and perforation of the cornea can occur. There are many causes of neurotrophic keratitis as congenital corneal anesthesia, lesion intrageminal ganglia or nerve infection, diabetes mellitus, contact lenses, topical drugs, post LASIK or PRK or PKP, post irradiation, congenital corneal anesthesia occurring in the 1st year of life, like this baby, and in vivo confocal microscopy we found that there is deficiency of subbasal epithelial plexus of nerve. This is the normal, and this is the abnormal situations. Infection as herpes simplex, herpes zoster, and leprosy. Post-surgical in treatment of trigeminal neuralgia, post-LASIK, post-vitrectomy, excessive or heavy endolaser after PRP in diabetic retinopathy. Also in advanced lattice and granular dystrophy, many drugs can cause also as anesthetics, beta blockers, non-steroidal anti-inflammatory, and sulfonamides. Systemic disorders as diabetes mellitus, vitamin E deficiency, and toxic as chemical burn, hydrogen and carbon dioxide exposure. In special consideration in diabetes mellitus and refractive surgery in diabetes can affect or can cause neurotrophic keratitis by many mechanisms as decrease density of subbasal plexus, or diabetic neuropathy, or complication of treatment, especially after vitrectomy and heavy endo laser. Refractive surgery also can cause neurotrophic keratitis, LASIK, PRK, and smile, femtosmile. Stage according to the McKay, 3 stages. Stage 1 in the form of superficial pancreatic keratitis that lead to stage 2 persistent epithelial defects, stage 3 ulceration and other complications. Stage 1, the most characteristic feature is SPK with dried epithelial facets, and also rose Bengal. It is very characteristic rose Bengal staining of the lower palpebral conjunctiva. Stage 2, there is oval epithelial defects here, as seen here, oval epithelial persistent epithelial defects surrounded by loose epithelium, stromal swelling, folds in this membrane, and AC reaction. Stage 3, corneal ulceration, thinning, melting, and even perforation can occur. Evaluation corneal sensation. We must evaluate the following: corneal sensation, corneal staining with fluorescein and rose Bengal, confocal microscopy in vivo, confocal microscopy, lacrimal secretory tests. We have quantitative and qualitative measurements of the corneal sensation, either with cotton tip, quantitative using Couché-Bonnet anesthesiometer, give us the quantitative measurements of corneal sensation. Corneal nerve imaging by confocal microscopy, wide field fluorescence microscopy, nerve fiber density. Confocal, this is a normal sub-MCR plexus. This is a normal sub-ABCR plexus, and this is here in neurotrophic keratitis, there is deficiency of nerve fiber layer. Management according to the stage. Stage 1, just preservative-free topical lubricants, and the autologous serum is very, very important and give a good results with contact lens and systemic tetracycline. Stage 2, we add systemic tetracycline mydriatic cycloplegic for AC reaction. Stage 3, we can make surgery, many types of surgery, drug to prevent melting, drug to promote healing. Surgery, we have a lot of surgical maneuvers as punctal occlusion, glue, limbal stem replacement, conjunctival flap, amniotic membrane flap, tarsorrhaphy, and penetrating keratoplasty. We have a recent management, growth factor, eye drops, amniotic membrane modalities, cyclosporin eye drops, autologous serum with umbilical cord eye drops, recta ora eye drops, omega-3 fatty acid, nitroguanine tablets, and the corneal neoprotalization. Amniotic membrane, we can use, amniotic membrane has a pluripotent cell, growth factor, antiproteolytic, high organized collagen, immunomodulators, and the matrix protein. Amniotic membrane, we can use it as a whole to cover the cornea, or amniotic membrane fluid eye drops, or amniotic membrane extracts eye drops, and amniotic membrane used as a contact lens. This is the summary of how you can use the amniotic membrane. This is a case of amniotic membrane transplantation as a whole. This is Procera, what's called amniotic membrane contact lens, made by clipping of a piece of amniotic membrane between two rings of clear flexible rings acting as a contact lens. This is the amniotic membrane, and this is the two clips and put in the cornea as amniotic membrane contact lens. Also, we have amniotic membrane eye drops. Nerve growth factor eye drops, it is ready made now. It's called the Exervate eye drops. Nerve growth factor eye drops. This is the shape of Exervate eye drops. And this is a case of post-keratoplasty, pretending keratoplasty, neurotrophic keratitis. Just use nerve growth factor eye drops. It is improved in 6 weeks. Cyclosporin also, with or without autologous serum, give a good results. Omega-3 fatty acid recently discovered to be helpful for corneal regeneration, especially after refractive surgery. Serum eye drops, patient autologous serum, or umbilical cord blood or both together. And umbilical cord eye drops also the before treatment and this after treatment. Drops prevent melting. We have systemic tetracycline, patient autologous serum, cyclosporin, and the most recent what's called regenerating or recta ora eye drops that is newly discovered. Recta ora agent, what's called Confocal eye drops, it is ready made and it is very, very nice for the cornea to prevent melting. The dose is 1 drop every 3 days for 3 months. This is the shape of Confocal eye drops. Systemic nitroguanine, this is recently used, essential for treatment of senile dementia, found to enhance epithelial healing by increased growth factors in the cornea and the lacrimal glands. Corneal neurotization, just we use sural nerve grafts, regional, contralateral, supratrabecular nerve transplantation. We can take care of these 4 drugs: corticosteroids, non-steroidal anti-inflammatory, and topical anesthetics. and decongestant. We never use decongestant. We never use topical anesthetics and non-steroidal anti-inflammatory, and be cautious in using corticosteroids. Our message: don't be rushed in prescribing antibiotics that may worsen the condition. Testing of corneal sensation is essential. Any corneal ulcer in the first year of life, consider it congenital corneal anesthesia. Neurotrophic keratitis is the main common disorders after post-refractive surgery. Neurotrophic keratitis is the second cause of after viral infection after PKP. Neurotrophic keratitis is the most common corneal disorders after vitrectomy and panretinal photocoagulation. Thank you very much.